for Best Urgent Care Collaboration, and also the finalist at the HSJ Awards. Sue has recently completed her master's in Advanced Clinical Practice and completed a service improvement project to implement a bespoke fully electric vehicle to improve the efficiency of the initial assessment process with UCR. Now, due to the project's success and its contribution towards the Greener NHS initiative and, of course, our NHS net zero policies, she is very proud to have been awarded the Allied Health Professional Greener Award, and as well as being the overall AHP of the year for 2023. Now, what I would like to actually say to you as well is that actually, Sue, I think you're going to actually show us very proudly of our first ever Greener AHP pin badge that you are wearing very, very proudly.
So yeah, it's right here.
Perfect. So without further ado, I will be muting myself, and the platform is all yours, Sue. And thank you very much for joining us and actually presenting to us again today. Thank you.
Thank you so much, Venus, for that really wonderful introduction. You've actually done one of my whole slides, which is absolutely fantastic. It's really nice to see everybody. Before I carry on, can you all see my first slide? Yeah, perfect. Okay, fantastic. So now this is where I now have problems with moving things, isn't it? So we've already done the housekeeping. So just a little bit of the introductions. I'm not going to read it through, but just to let you know what I'm going to be talking about today, and just to cover everything. And as you know, Venus gave me a very glowing introduction. So I was qualified late as an occupational therapist, so a mature student. Prior to becoming an OT, I worked an awful lot in the care industry, right from a healthcare support worker up to a senior team leader for Royal Mencap, and also I became a home care coordinator for one of the national care agencies, and that led me naturally to spending quite a lot of time with occupational therapists, putting care plans together, and it's one of the reasons that sort of inspired me to become an occupational therapist. So I work within an urgent community response team. So this is a consultant-led practitioner and advanced practice-led. It's a multi-professional team of nurses, OTs, physios, paramedics and healthcare support workers. And our primary aim is really to assess and treat patients at home who are at acute risk of hospital admission. So we work across the Mid and the North Hampshire in partnership with the South Central Ambulance Services, the Hampshire Hospital Front Door Frailty team, and as an entire service, we provide clinical support using our Falls and Frailty car, our bespoke urgent community response van, which is what we're primarily talking about today, and we do direct clinician visits to people in their own homes. So our patient group is people who are over 65 living with frailty or are at acute risk of hospital admission. So our clinicians respond to 999 category 3 and 4 calls, 111 calls or GP referrals within 2 hours, and we provide specialist lifting equipment, therapeutic interventions, and we can diagnose and treat people to enable them to remain at home rather than be deployed into hospital. So before I go any further, I really just need to let you know, I take you back to the beginning so that you can understand what the challenges are faced by our elderly population, how the concept of our fully electric vehicle materialised. So the number of people, older people, has increased as each decade passes, as has the proportion of the population occupying those older age groups. So the community that we serve is very diverse, it's large and with a mix of rural and urban areas, which is also with a population of approximately 570,000 people. This is expected to grow by 11% by 2025, with the largest increase forecast to be over those 75-year-olds. It's recognised that there's a real need to ensure that patients get the care that they need fast, and also to relieve pressures on emergency departments. Paramedics are many patients' first contact with health services, and thus they have the potential to influence a patient's care pathway. We know that patients over 75, often with complex comorbidities, are not getting access to specialist geriatric assessment and care planning soon enough. And as a result, they are often conveyed unnecessarily to hospital. And we know that the likelihood of admission and length of stay increases with age. Frail older people are often subject to multiple moves, multiple assessments and significant levels of deconditioning whilst in hospital, and this is going to have an adverse impact on their patient outcomes. So the Falls and Frailty Car initiative was started in November 2020 during the peak of COVID to prevent those long lies, look at falls prevention and reduce the pressures on our acute hospital services. And I was really lucky to be part of that original team to get it set up and running. And its success really led us to consider if we could adapt the way our core UCR service was also being delivered. So on the Falls and Frailty Car, it's manned by a paramedic and a frailty practitioner who attend patients who have fallen. And everyone that was part of that project really recognised how much time was being saved by having all of that essential equipment on board to attend to a patient's acute medical and physical needs. So as part of my master's, I needed to complete a service improvement project. And it led me to explore some of the challenges that we were facing as a team within UCR and to see whether we could replicate a similar style of service delivery to improve our efficiency. So we completed an internal audit which identified that we were wasting quite a lot of time and resources during our initial assessment. So you can see on the slide, this cause and effect diagram detailed how we were originally operating. So basically a referral would come in, a senior clinician would be sent out to the patient. And as standard, our clinicians would carry their basic OBS kit and a blood box. But should they need anything further, such as diagnostic tests like an ECG machine or a bladder scanner or any type of mobility equipment aids, they would have to phone that through to triage, who would then request that additional support. And because our patients are in crisis and at risk of admission, they need everything actioned immediately. So this took an awful lot of coordination and deployment of several other members of staff to bring these essential items to the patient immediately. So one example that we took from an audit found that on initial assessment, one patient took 5 hours of clinical time, 3 team members and 3 separate mileage claims. So now we have our fully electric bespoke vehicle, which you can see proudly on the screen. And it's now manned by an advanced clinical practitioner, so someone like myself or a nurse practitioner and a healthcare support worker, so that we can respond immediately to a patient who is acutely unwell. And we have everything now on hand to complete a comprehensive assessment of their needs and provide them with the equipment that they need to be cared for at home. So we put together grab bags, much like the paramedics team do, but ours hold things like blood boxes, point of care testing, medication grab bags, which contain medications under patient group directives, a basic wound kit, a catheter kit. We have an ECG machine, a bladder scanner, a razor chair, a Mo lift, and lots of basic mobility equipment aids such as wheeled Zimmer frames, Mowbrays, bed levers, etc., etc. So the other advantage that we've had of having this larger vehicle has been that we've been able to order and immediately collect and deliver mattresses, Dreammaster mattress variators, and we also have a full hoist that we've been able to use to support our community therapy teams for patients who have equipment failures like damaged mattresses. And we've been able to immediately hoist them up, swap the mattresses over and pop them back down. So by having that, we've been able to significantly improve our response time to reduce risk of injury or pressure damage to patients, and we've prevented quite a few multiple avoidable admissions due to equipment failures or delays. So why did we choose an electric vehicle? So from our original pilot of the Falls car, we could pull down the data to demonstrate that we were preventing admissions, and that we're able to use this data to take to our stakeholders and put a case forward that that it would be beneficial for us to have our own bespoke van, working initially across the North Patch. We needed to obviously engage our stakeholders. So in all honesty, the first reason for us choosing an electric vehicle was driven by costs. Our demographic area is very large, with some patients living up to an hour away from our service base. So from a costing point of view, we were able to demonstrate that having an electric vehicle on lease would bring several significant cost savings. So because it's a lease vehicle, this means that there's no huge initial outlay of finances. The package was over a 5-year period and included a comprehensive service agreement, which covered all the major services, breakdown covers and replacement tyres. So this basically means that our monthly budget remains very stable with no major or unexpected costs. With the average cost for a petrol or diesel vehicle costing on average 1.65 pence per litre, having a fully electric vehicle has taken this average down to 34 pence per kilowatt hour. So current research suggests that on average, the cost to fuel an electric vehicle for over 8,000 miles is approximately 61% cheaper than a petrol equivalent. So also because it doesn't have internal combustion engines, it's got fewer moving parts. And this means that over the lifetime of its use, the maintenance costs should remain lower than a standard vehicle. And since we've started using our dedicated van, we've also seen a reduction in our staff's average monthly fuel expenses, because they're each using this van on average once a week instead of using their personal cars. So obviously the wonderful addition to having a fully electric vehicle is of course the improvement in our environmental impact within our local communities. So the NHS as a whole recognises our obligation to work in a way that has a positive effect on the communities we serve. And this means delivering high quality healthcare whilst ensuring we spend public money well and are smart and efficient in the use of our resources. So Southern Health has a 2022 to 25 green plan, which has been developed to reduce the environmental impact of the activities whilst supporting that NHS long-term plan to focus on sustainable healthcare. So our little van, although small, is taking real mighty steps towards these targets. We know that road transport is a major source of air pollutants, with 34% of nitrogen oxide contributing to 80% of concentrations at the roadside. So using our van, we are visiting patients and producing zero exhaust emissions within our local communities. We're also contributing to reducing noise pollution. The World Health Organization estimates that noise impact from road traffic is second only to pollution as the biggest environmental impact of vehicles, and affects human health as well as damaging our environment. Several of our patients have expressed how reassuring it's been to see our vehicle arrive outside their home, so that they can first of all identify us by our logo, but that they're really pleased that our service has modernised to consider how we can reduce the environmental impact whilst also providing such an essential service. So looking at the bigger picture of the environment, it's essential that we all realise our changing climate is contributing to rising incidence of cardiovascular disease, asthma, cancers, and diseases that are rising from air pollution, obesity and poor diet. These issues are also exacerbated due to rising health inequalities experiencing in all areas of our country. So our climate emergency is a health emergency because it threatens the foundations of good health, which has significant impacts to our patients and the entire population. And as a result, the efficiency and resilience of the services the NHS strives to provide. So we're all custodians of our planet. And as health professionals, I think we're really well placed to making small but significant changes in the way we deliver services and to educate others. So again, our small and mighty van within the UCR, we're bringing those services to the community to reduce the need for individual patients to access carbon heavy facilities such as the hospital. Looking at the van just itself, we're reducing those overall journeys from multiple staff members within our communities. And already, as explained, we're reducing that zero exhaust fumes. So from a medication perspective, we've got a couple of grab bags which can be prescribed under a patient group directive, which I'm working on my competencies. And we also have several prescribers in our team. And we actually spend quite a lot of time de-prescribing medication, which are no longer appropriate for our frail patients. And our ability to remotely prescribe is also reducing the need for patients to have to access carbon-heavy facilities such as pharmacies and local delivery service. And this is obviously reducing the overall production of costly medication, which may no longer be needed for our cohort. So we are also really proud to be starting the point of care testing. We've recently launched this project and it's won a Health Heroes Award for Digital Innovation in Healthcare just a few weeks ago. This means that we're now able to obtain an instant CRP and renal function blood test result to inform our diagnostic reasoning in combination with a patient's overall clinical presentation and commence that treatment immediately. So this is reducing the amount of blood drops that we're needing to do to our hospital and further reducing our time on the road and the vehicles that we're using, again, reducing that carbon heavy processing of the laboratory in the hospital as well. So from an equipment point of view, we're supporting patients during the acute phase of illness. So through our interventions, we're preventing patients from deconditioning and therefore hopefully not requiring those complex equipments or daily living aids because we're keeping them independent and reducing the need for them to have to access care services long term. And obviously, finally, health education. By putting our patient at the centre of everything we do, we're giving them the tools to manage their own health and well-being. And we spend a lot of time helping people to understand about their health conditions and how they can help themselves to remain fit and healthy and prevent further health crises in the future. So challenges, there's always challenges with a project. So getting staff engaged in change, I think is often the biggest challenge. No one likes change, but by including everyone at each stage, it helped them to feel part of the journey. So we invited everyone to design the logo and the whole team voted on the final design. We also did some in-house training to make sure that everyone was confident and competent to assess and issue basic living aids and mobility aids, because many of those on our team, that is really outside their usual scope of practice, and they were a little bit nervous about that, but they're now successfully doing that and under our therapy guidance. A clear standard operating procedure and staff vehicle user pack was completed to ensure everyone was safe and competent to drive a fully electric vehicle. We took everyone out on a little mini driving test, which was quite hilarious for some of us. And we made several amendments to this paperwork because staff weren't reading or filling out the statistical data which we were trying to capture. We standardised the induction process and again, as I say, we did driving tests because some people really felt quite nervous about driving a larger vehicle, so we made sure that they were comfortable with that. Some of the challenges that we had with the processes were surrounding how the vehicle would actually be charged overnight. We were really lucky because we have electric charging points outside our main office, which we were able to tap into. And we also have now managed to get a bespoke fuel card, which is dedicated just for the use of the company vehicle. We've had some occasional difficulties with the charging of the vehicle over the winter because the charging ports are frozen. But I know that this is not just a local issue. It's something that quite a lot of people say about electric vehicles, and it's something that we're looking to address in the future months. So the results. So we've been operating our van now for just over 18 months. And over the last 12 months of this service, a total of 635 patients have been seen, of which 82% remained at home. And this means that the environmental impact of 521 emergency ambulance journeys were avoided. Every patient not conveyed to hospital saves over £2,000 in acute ambulance costs. So each month, this initiative saves around 200,000 in acute costs. So I think you can agree that those statistics in itself really speaks volumes, but there's been so many other successes that have come from this project, and ones that I didn't really originally anticipate. We originally launched and tried to partner with the 111, but we didn't get many referrals from them originally. And we know, like everything, change takes time to evolve, but we are forging much stronger links with the specialist clinicians who work within the ambulance services. And we've always adopted a really positive, proactive and flexible approach. And this has helped us to become quite well recognised and trusted as clinicians, so that the ambulance crews on the end of the phone feel comfortable to hand those Cat 3 and 4s over to us within our local area. There's still so much more that we can do to create a bigger impact on those numbers, but we now are starting to get a clear pathway to move forward together. So as a team and for myself emerging as a leader, I found it really wonderful to see how much pride our team has had for the service. I've conducted several interviews with the staff about their experiences of using the van, and all of them have mentioned about how much it's given them time to get to know each other as a team and understand what different skills each of us bring to the service. Given the team something to really take ownership on, and seen some of our team members really flourish. This inclusivity has been quite contagious, and I regularly have team members approach me now with not only new ideas, but also really tangible solutions that we can try. So it was really originally my baby, it's my project, and I wanted to be involved in every aspect of it. But because the team are really invested in continuing to make it a success, it is running quite smoothly, and it's freeing me up to think about what we can do next. We are now visiting our patients within a 2-hour response and immediately have access to all the key diagnostic tools and essential aids to enable patients to remain at home rather than to go to hospital. Time and time again, we receive really positive feedback from patients and families about how reassured they are that our team has been able to help them during acute time of illness. Living with frailty means that you don't ever have just one thing wrong with you. It's always multifactorial, and that current illness will be impacting their abilities to care for themselves and do the things that are meaningful for them in their daily lives. Our team really understands that and can support patients to not only recover from illness at home, but also to understand what's led to that illness and to help them to reduce the risk of needing crisis intervention in the future. This is through education, provision of mobility and essential living aids, and signposting for provision of their changing care needs. Our bespoke vehicle has really given us the ability to bring all of that to them in one seamless visit. So what's next? So at present, we only have one van. So as you can imagine, out of a team of 30 people, not all of our patients are currently being visited by this bespoke vehicle. Therefore, we're still not being as efficient financially or in terms of our greener agenda. I'd really like us to be able to purchase more vehicles for our service. At the moment, our sister team in the mid are in the process of purchasing their own electric vehicle and replicating a similar style to us. We have been approached by a few other trusts in the country that's heard about our services and are in the early stages of engaging their stakeholders. It's been really positive to talk to them and share our ideas. And for me personally, I'd really like to get my research published so that our success can be fully contributing to the body of evidence to show how the NHS is fulfilling our agenda for change to reduce that environmental impact through sustainability and effective healthcare delivery for a healthier future within our communities. So that's the end of my presentation. Thank you so much for listening, and I wonder if you have any questions.
Brilliant. Sue, this is absolutely brilliant. Thank you so much for actually sharing a fantastic